Now, COVID is taking an emotional toll across Europe and the United States, with rising levels of apathy among some populations. The same could be said of South Africa. The World Health Organization says a new survey reveals the scale of what it terms pandemic fatigue. It's estimated to have reached over 60% in some cases. Essentially, people are feeling less motivated about following protective behaviors after living with disruption and uncertainty for months. I want to talk more now on the mental health side of the COVID-19 equation. Clinical psychologist Saths Cooper, good afternoon to you, and a very warm welcome. This is always a difficult one, I imagine, to navigate, but the reality is most of us are at the end of our rope.
I think so. After some 7 months since the pandemic was officially declared, I think there doesn't seem to be an end in sight over the next couple of months. And we all seem to be just waiting for vaccines which may not reach the majority of people in the world soon enough. So we're in for the long haul, and most people's lives have been indelibly disrupted. Economically, I think in all societies, people have taken a deep knock. The other important thing is we've been thrown on our own resources, Jeremy, and we've not been used to relying on our own resources and one or two close people around us, because they also confront the same issue. So when we look for help, the persons we seek help from and support from are also confronting the same issues. And we are all in this together, but some are better off than others. And that's unfortunately the depressing scenario.
And the propensity, I imagine, for more reckless behavior is increasing.
I think the kind of thinking that emerges is, well, I may be exempt. It won't happen to me. You know, it's for all sorts of things out there, epidemics out there, that it won't happen to me. There, but for the grace of, is not me. It's somebody else. And I think we don't have currently the pictures showing the drastic measures taken when people are in ICU, because that was what we were confronted with on a daily basis in March, April, and into May. And then somewhere around the middle of the year, it became normalized. So all these things, as soon as we become used to them, we become inured to them, we think we are inoculated against them. And that's the danger. And also forgetfulness. Sometimes we forget to just put the mask on. And that's happened to it's happened to me, where I've been reminded by somebody, thankfully. And then I go to certain stores which had rigid strictures, and then nobody's there. And I ask, why are you not there? And then it's like, you know, the typical bureaucrat, well, why are you troubling me? And they just give you a little squish on your hand. So I don't think there is the adherence. I don't think that the people who ought to be monitoring this are doing their work. And these are civil servants that ought to be doing this, and they're simply failing us. And also, we may feel we may get a spike in infections, as we've seen in the last couple of weeks. It's been going up and down. So I think adherence, remembering to constantly ensure one doesn't touch, where one washes, and wear a mask for your own and the protection of others. It's the best thing. But also to speak to others in a way that enables them to feel supported while supporting you. It's a hard one, because all of us have needs, but we should try to reach out to the people closest to us and understand them, particularly the vulnerable around us. We need to help.
I want to just very quickly pick up on one of the more vulnerable sectors of society, and I don't think we talk about this group enough, and that is senior citizens. And in the United States and in Europe, there are reports of excess dementia deaths because of senior citizens losing those personal connections. That's tragic, isn't it? But in many cases, unavoidable as you balance the social connections with the need to stay safe.
Well, look, in many parts of the Western world, we have old age facilities, and these have been wrecked. If you've followed the statistics in Italy, in the UK, in the US and other places, old age homes, senior citizens' villages are wrecked with this because of our vulnerability. And they don't have the necessary interventions and support systems that they ought to have in those facilities, and also from the public. We tend to forget them. Just like children, we only worry about them when we need to, and when an outbreak happens, we get concerned. So the invisible amongst us, and I fall into that category now, I think we tend to forget, and that's where we are likely to lose connectivity, we're likely to lose our history, our relationships, and that elder touch, which is very important, not literally, of course, but in other ways that we can continue to retain those essential relationships. Because when they're gone, it's too late to cry over them because they won't be there.
Saths, I fear I'm in that same category as you are, but let's soldier on, shall we? Clinical psychologist, Professor Saths Cooper.